Of it's time to let go, that sometimes people will close their eyes and stop breathing and die.
What message or information would you like to share with young people about this disease?
Well, the disease, it's important to always follow with your doctor. It's important to get all the treatments there are out there. But it's important also to know that there's a lot of help for hope and support, regardless of who's at home, what's going to happen next, what are the symptoms going to be. Is it going to be terribly painful? There's a lot of help for that. Palliative care is multidisciplinary with nurse, chaplain, as we mentioned. It's support throughout that illness. It's encouragement to continue to see your doctor and continue to get treatment. But it's also important to talk about things. You know, what if the disease is incurable? What's going to happen next? What do we need to do? How can I support you? We talk about feeding tubes and ventilators and CPR, you know, where they do resuscitation measures. It's important to talk all about that stuff because sometimes that's very important to continue. And sometimes we need to think about, is it as important as comfort measures at the end of life?
Okay. Thank you so much for doing this with me.
You're welcome, and good luck to you.
Thanks.
Thank you.
Today I'm interviewing Dr. Lee Pritchard Boone, who is a clinical psychologist here in Florence. Dr. Pritchard Boone, thank you so much.
You're very welcome.
I've been doing my research on breast cancer, and one of the things they've been talking about is emotional health. That's very important. How can people find and maintain a healthy emotional life?
Well, Julia, that's a really good question. It's a very difficult question as well, but an important one, I think. Finding emotional health in life has a lot to do with finding balance. I think a lot of people spend a little bit too much time on work and not enough on some relaxing activities. Some people do the opposite, you know.
Yeah, I know.
You know who I'm talking about.
Yeah.
But I think what is most important is finding that balance where you can enjoy yourself, enjoy your life. We only live once, and but also able to get the things done you need to get done. One of the main things that you need to have for a good, strong emotional health is good coping strategies. And that basically means knowing what to do when things get difficult, knowing what to do when you get stressed, using different relaxation strategies, and knowing how to relieve your own stress.
What have you seen happen to people who don't maintain a healthy emotional lifestyle?
Well, stress can cause a lot of different things. We know that stress can impact our heart. It can impact our blood pressure and the way that we feel in terms of being tired, and it can affect our joints and our bodies being sore. It can also affect our tempers, and we can be quick and snap at people. It definitely affects our relationships and makes it difficult for us to communicate with other people. Basically just makes it difficult for us to get our needs met if we're not taking care of our emotional health.
Does a strong faith or spiritual life help?
Absolutely. Psychological scientific literature shows that a belief in God as well as prayer reduces the stress on the body, reduces the stress on the mind, as well as it provides a positive coping strategy that we had talked about before needing to have. It allows people to give control over to God and to feel a little bit more at ease with some of their more difficult problems.
Does medication help someone who is depressed?
Medication can be very helpful for someone who is depressed. The research shows that the best combination of treatment for depression is both therapy as well as an antidepressant medication. If the person is either moderate to severely depressed, mild depression can most effectively be treated with therapy.
Will medication increase the risk of cancer or other diseases?
Well, there are all sorts of medications that have been shown to increase carcinogens in the body, as well as to be associated with developing cancers. And I think the best judgment to make on those cases is how would the person function without the medicine? Is it more important that they have the medicine than the potential risk of the medicine? But the most important thing is that patients are being informed about the risks of the different types of medicines.
Do patients seek therapy prior to any medical or surgical procedures for breast cancer, or do they typically look for support afterwards?
I think they probably have a tendency to look more for support afterwards. It's unfortunate, I think, that sometimes when the word cancer is brought up, that people respond so strongly medically that we often forget about the needs of the emotional health of the patient, needing to make some contacts and get in touch with some survivors and some people who are having a similar battle, because how a person manages their diagnosis emotionally can impact how they fare physically. So medical doctors and psychologists really need to work together for cancer patients to promote the best outcome and give them the best advantages for recovery.
Is there anything special you'd like to mention in this educational DVD on breast cancer awareness for Girl Scouts?
Well, I think that one of the things that I just would really like girls to know is that it's difficult for a lot of young girls to talk about the breast, and it can be embarrassing and things like that. But it's definitely an area where we need to become more aware, and we need to realize that this is part of our bodies, and we need to take care of it just like we take care of other parts of our body. So I commend you for what you're doing. I think what you're doing is wonderful, and I think an educational DVD is imperative for our young children, and kudos to you.
I'm talking today with Miss Ludmilla Pusey, who works at Caroline's Hospital as an oncology nurse. Miss Luda, thank you for letting me interview you today.
You're welcome. It's my pleasure.
I understand that chemotherapy is the use of an anti-cancer drugs to treat cancer. Is that right?
That is correct.
So are the breast cancer patients that you treat in the hospital pre-surgical, post-surgical, in the later stages of breast cancer, or all the above?
Basically, it's used for all the above because, it depends on what the final goal of therapy is. If it's to shrink the tumor prior to surgery, or treat along with radiation, or treat after surgery to make sure that remaining cancer cells will be gone. Basically, it's used in all three settings.
Is chemotherapy always used along with the surgery and radiation to fight this disease?
Not always, but depends on the physician's approach and depends on the stage of the disease. It's probably more likely to have chemotherapy involved in later stages because some women opt for just a surgical treatment, and at that point chemotherapy probably will not be used, especially considering the side effects you can have from chemotherapy.
Is it the drug or combination of drugs that determines the severity of the side effects?
I again would say that it depends on the drug used, but generally the more drugs are added to the chemotherapy regimen, then each one, as much as it helps the other to work against cancer, each one probably adds to the negative side as far as development side effects. So I would say that the more drugs are used at the same time, the more side effects would be produced by them.
How well do the medications given for the side effects work?
with latest anti-nausea, antiemetic medications, if the patient takes them as prescribed, especially starting even the day before getting chemotherapy, and the first, usually, doctor says 48 to 72 hours after getting chemotherapy, it's highly effective. The problem is that some people think, I woke up after my chemo the next day and I feel okay, so maybe I'll just go without it for a few hours and see how I feel. At the point when you do not feel well, they probably will not get your nausea under control. I would say the nausea, as far as people's complaints after chemotherapy, is probably the highest. Weakness and nausea, right, up there. So if the drugs are taken the way they're supposed to be, like the regimen tells them to, then they're highly effective. It may not provide 100% relief from negative symptoms, but really it does help a lot.
Do you find yourself not only being a nurse but a caregiver, comforter, and listener to these very sick patients and their families?
Yes. Nobody may prepare you for that, but ultimately you become a listener, a teacher for these patients, not because you necessarily been through this experience yourself, but because you've seen it so much in your profession that you just happen to have that knowledge, and you can give people advice from what you've seen work for other people. And oncology nurses, oncology physicians also have phone numbers, website addresses for reputable sources for patient teaching, for also patient support groups nationally and locally. And yes, a lot of times, you find yourself in that position, and I do not mind. I actually enjoy quite a lot that part of my work, not just giving chemotherapy, but also being a counselor, so to speak, to my patients and their families. That's a good question. That is, a big aspect of being an oncology nurse.
Have you ever had a male breast cancer patient?
I have probably, unfortunately, one of them was in a very late stage and was on hospice, so he was no longer actively treated. I did not follow him during his active treatment. I do not know how long he was on treatment and how advanced his cancer was when he was diagnosed. But like I said, I got to take care of him when he was on hospice. And there was another patient who had a successful treatment, and he was coming back to your clinic. At that point, I worked in an outpatient clinic that was just coming back with a shot. What you got to do? And once a month for hormonal shots, basically suppress any kind of hormonal problems that might be causing his cancer to grow or start growing again after the treatment. So not too many experiences with male breast cancer. It is pretty rare. And those two that stand out in my mind. One was late stage and one was a successful after treatment case.
Have you ever cared for a very young woman with breast cancer?
I did once. She was about 27 years old, and oddly enough, she did not have any familial history. It was one of those out of nowhere cases, and it was a very aggressive, inflammatory, also pretty uncommon inflammatory breast cancer. And from what I understand, the treatment outcome for it is poor. I did not know how well she did in the treatment. I was there for the beginning of her treatment, and in the beginning stage, she was doing okay. But as far as her response to the treatment, I am not sure about that, about her particular outcome. But for young ladies, it's very unfortunate because she just got married, and a lot of them do in that age, and you have to think about whether you can or can't have children afterwards, because some chemotherapy will damage your reproductive system. You can't have very difficult decision what to do, whether to just go on with their life and live it, without the treatment and see how far she can get, or treat and to see how successful it will be, and hopefully, go on with the rest of the life for a long life. So I think for young people, it really is quite a shock to be facing all those decisions so early in life.
When is hormone therapy an option for these patients?
Hormonal therapy is only used for tumors that basically, in simple words, they feed off the hormones for their growth, and usually they're called estrogen receptor positive, and that means the estrogen, which is one of the hormones, stimulates their growth. So as long as they have estrogen in the blood, they will keep growing. So there are some hormones given to suppress that. Other hormones are given to ablate the ovaries. So ovaries do not produce these hormones, and there's some long-acting shots. They are almost like an implant shot that's given in the belly for women after they got treated. Basically, it shuts down their ovaries, and so there's no estrogen, stimulating the tumor growth. And the others given the pill form, basically they only use for the tumors that have been proven, and by test there are, hormone positive tumors.
Is it used along with chemotherapy?
Hormonal therapy is usually used after the chemo is over, for more of a long-term prevention of the further cancer development or relapse. That's been in my experience. There are probably cases when it could be used along with, but most of the time it's a later stage of treatment. After patients complete their surgery, chemo, radiation, the hormonal therapy, they will stay basically on the hormonal therapy for the rest of their life.
Is there anything special you feel that needs to be mentioned in this educational DVD about breast cancer awareness?
I noticed a couple things, like, I'm not sure if you've heard about lymphedema. It's a problem that develops in women after breast surgery. Basically, after they remove the lymph nodes and the breast, the whole circulatory system is not working very well in the arm, and you could see that it's swelling, and it could be quite uncomfortable in the arm and armpit. And the little exercises. The simplest one is, believe it or not, airbrushing, using that arm. People say that arm because naturally if it doesn't feel good, you protect your bad arm, you don't move it around, and the best thing for it is to move your arm around. Do simple exercises, no heavy lifting or anything, but just moving it around, elevating it, and making sure that the swelling goes down. And also, Julia, I wasn't sure how much information you have on the cancer support network. I looked up in my nursing book. Some of them have 800 number. Some of them just have the address listed, but a lot of them handle things like post-treatment decisions and problems that women face, such as, on the treatment, it's usually alopecia with hair loss from the chemo regimen, and with the wigs and scarves and things. Also, after the treatment, after surgery treatment, a lot of ladies have to make a decision whether to use the whether to use prosthesis or breast implants for breast reconstruction. And that's just about all I can think of. As long as that was not mentioned in your question.
Thanks so much for doing this.
You're welcome.
Today I am interviewing Miss Kitty Finklow-Rogel, a registered dietitian and personal trainer. Thank you so much for doing this with me.
My pleasure.
According to the plan for my specifications in mypyramid.gov, do the recommendations equal a healthy lifestyle to prevent breast cancer?
I think the food guide pyramid is a great start because it really helps you find a calorie level, and it also gives you an exercise plan. And two things about breast cancer prevention is being at a healthy weight. So for people that might be fighting a weight battle, it's a great place to start. And then it also encourages regular activity, which is another thing that helps prevent breast cancer. As far as the guidelines go on My Pyramid, they're kind of generic. They're great as far as telling you how much to eat, but like they're not really specific on breast cancer. It's more general guidelines. So like it says that you should have 2 cups of fruit, and it doesn't specify that for cancer prevention, fresh fruits with edible skins and seeds and really dark, rich colors like blueberries and strawberries are really good to help prevent breast cancer.
Would you recommend that people who are computer interactive use the My Pyramid plan to help them see what they eat and where they're making mistakes?
Yeah, like I said, I think it's a great start, because it can give you menus, you can probably get recipes from it, so it's a great guideline, definitely.
Are there certain ways of preparing food that are better than others?
Yes, there have been some studies that show, particularly with meats, that if you prepare them at high heat amounts, like frying and broiling, that it develops these products called HTAs, which are, I have to look, heterocyclic amines, which increase the risk of all types of cancer. So baking is one of your best methods, and stewing at lower temperatures can help prevent the risk of cancers.
One of my survivors, I was talking with her, and she said that she and her husband, when they're grilling, they don't use charcoal because they use wood burning fires.
Well, what the studies show is if the juice from the meat hits it and comes back up, that's when those HCAs really develop. And one of the guidelines I've seen as far as cancer prevention is to really decrease the amount of red meat that you eat to maybe 3 to 4 times a week if you eat red meat.
I've heard many people say that garlic, fish oil, flaxseed, soy products, omega-3 foods, antioxidants, and high-fiber foods are important. How does a young adult like myself, or adults or parents and leaders know what we need to do nutritionally to stay healthy?
Well, one thing that you want to think about that's probably the easiest thing to do is to eat more from the way foods are grown in nature or the way that God created them, as opposed to processing. Because kids nowadays tend to eat so much fast food and processed food that they really don't eat foods from the earth. So one thing you want to think about when you're doing cancer prevention for parents or students or anybody is to think about how often you're eating fresh fruits and vegetables and foods that actually grow out of the ground, and how close are they to that source. So like, for example, an apple with the skin on it is going to be the best for you, particularly if it's grown pesticide-free. And then if you take the skin off of it, you're taking some of that good nutrition off of it. If you add sugar to it and you put it in a can, like applesauce, it's a little less healthy. And then apple juice or apple jelly would be the least healthy. It's not saying you should never eat those things, but what Americans need to focus on is to eat more fresh fruits and vegetables and whole grains.
Is it better to have an overall nutritious and healthy diet, or should we be more disease-specific in our food choices?
I don't understand the question.
Should we or should we not be more disease-specific in our food choices?
You mean like picking foods that would prevent breast cancer as opposed to a general diet guideline? One of the things that we're seeing in the literature is that a lot of the diseases that we suffer from are caused by inflammation in the body, heart disease and cancers, a lot of the different diseases that we have, arthritis. And there is an anti-inflammatory eating plan, which is, again, fresh fruits and vegetables, whole grains, lean meats, things that are grown sustainably as opposed to processing.
How does exercise affect your diet?
How does exercise affect your diet? That's an interesting one too. Exercise helps increase your metabolism. So some people will say they get hungrier when they exercise. Some people say they don't. So as far as your intake goes, it might increase your appetite or might not.
How much exercise and food intake do we need to be healthy and reduce our breast cancer risk factors?
Say that again?
How much exercise and food intake do we need to be healthy and reduce our breast cancer risk factors?
Dietary guidelines for general populations are different from what an individual would need. So if I was to look at you as an individual or a young teenage girl as an individual, it would depend on how active you are now. You know, I mean, because you have some girls that are doing a lot of athletics, and you have some girls that are sitting in front of the couch, you know, sitting in front of the TV on the couch a lot. So it's really hard to give a huge guideline for every person. But generally speaking, what I've read in the research is that we need about 6 hours of activity or exercise every week to decrease our risk. And that as far as nutrition goes, we need to be eating a really high fiber diet, lean protein, and low fat dairy, and healthy fats like olive oil, avocados, and nuts.
Is alcohol consumption good or bad in your diet?
There's a pretty strong link between alcohol consumption and breast cancer. Most of the research shows that if you limit your drinks to 1 or 2 a day, and one drink would be like 1 beer, 4 to 5 ounces of wine, or 1 ounce of liquor. So 1 to 2 drinks a day. And you can accrue it. You can't say, I didn't have any beer on Monday through Friday, so I'm going to have a 12-pack on Saturday. What the research is showing is that you need to keep a small amount or none at all.
Should we all try to reduce our fat and sodium intake?
Well, a lot of the research is showing that for breast cancer, we do need a lower fat diet, but the type of fat's really important too. So you don't want to be doing a lot of fried foods, a lot of butter, a lot of high fat meats like bacon. That the fats we need to eat need to be more like avocados, nuts, olive oil, that type of thing. So we do need low fat, definitely.
Through my research, there seems to be so many things to remember in our diets, precautions to take, and foods to avoid. Is there any easy way to stay healthy and fit?
I think if you make your lifestyle changes easy, like what I've found for a lot of people is they just don't plan. They just kind of eat whatever's available. And if you plan, like if you say, okay, for breakfast I'm going to have a high fiber cereal like Total, and I'm going to do skim milk, and I'm going to put some nuts and blueberries in it, and then tomorrow I'm going to have oatmeal with some fruit in it. If you start planning, then it is pretty easy. It is pretty easy being healthy.
What suggestions or tips would you give to the viewers of this DVD about the necessity of an overall lifestyle, including nutrition?
General guidelines related to cancer prevention are to maintain a healthy weight. So if you're overweight, even losing as little as 5 to 10 pounds can make a difference in your risk. Regular exercise, anywhere from 3 to 6 hours a week. Watching for that amount and type of fat, like we've talked about. Eating a lot more fresh fruits and vegetables. And again, if they have an edible skin or seed, they're even better for you. Limit your alcohol, 1 to 2 a day, can't accrue it. Limit your meat, cooking at high temperatures, and if you're eating a lot of red meat, you might want to think about cutting back on that. Making sure you get vitamin D. There's been a lot of good research on vitamin D and different types of cancers. So salmon, sardines, and vitamin D fortified milk products can help make sure you get a lot more vitamin D. And then there's a spice out now, curcumin, and well, it's actually an old spice, but that's been shown to decrease risk of cancers. And that's like in curry powder. So if people like Indian food, if you want to put a little bit of curry powder on popcorn, different things like that. So I think trying new foods, not getting stuck in the same food ruts, and really kind of branching out can make a huge difference.
Thank you.
Mm-hmm.